Hello, I'm Jeff. Hello, I'm Oliver.
Hello, I'm Sabrina.
And hello, I'm Megan.
Think back to television shows, movies, or even your own experience. Does this picture look like a woman in labor? This is a picture from the movie Orgasmic Birth, and this woman is in the middle of very hard natural labor. I've been an affiliated instructor of the Bradley method for 2 years, and I've given birth to 2 children, one with an epidural and one naturally. Natural childbirth is a process that involves learning about your body and working with it to avoid any unnecessary interventions. This includes induction as well as medication for pain during labor. The Bradley method of natural childbirth teaches women to stay healthy and low risk throughout their pregnancy to avoid any unnecessary interventions. We're going to talk about the classes I teach that include prenatal health, focusing on nutrition and proper exercise, classes on labor and birth that focus on relaxation, labor rehearsals, and birth plans, and then postpartum classes where we focus on breastfeeding, mother's recovery, and newborn care. Now that I've given you a snapshot of what we're going to talk about, let's talk about the prenatal classes. Pregnant women can stay healthy by maintaining good nutrition, proper exercise, and educating themselves about their body. This is discussed further in the Bradley Student Method Workbook. They focus nutrition on the Brewer diet. In this diet's main focus is having protein, and enough protein is 80 to 100 grams a day for pregnant women. It also recommends whole grains, a wide variety of different colors, different fruits and vegetables, water, and salt. There's no calorie restriction on this diet, and to keep you from gaining too much weight, but you should eat your nutritious foods first, and if you still have an appetite, then go ahead and you can have some moderate sweets. Exercise is also very important for pregnant women to maintain their health and prepare them for the rigors of labor. You wouldn't run a marathon without first training for months, and the same thing goes with labor. Cardiovascular workouts that are low impact are highly recommended, like walking and swimming, and exercises specific to pregnancy are taught. This includes tailor sitting, squatting, and Kegel exercises to keep your pelvic floor muscle in good tone. Relaxation exercise are the third types of exercise, and this trains your body to relax during that heavy, hard first stage labor to avoid increasing your sensations of pain. Learning about your body is also important in these classes because we need to make good decisions when we're pregnant. Anatomy of the mother and the baby as the baby grows is discussed, and we also discuss the importance of your partner's support throughout the pregnancy and the labor and birth, because they need to help you maintain your good nutrition as well as reminding you to do your exercises. Also, in learning about your body, it's also noted that there are no drugs that have proven to be without side effects for both mother and baby throughout labor and delivery as well as pregnancy. Now that we've talked about pregnancy, let's go into the labor and the birth of the child. Classes on labor and birth comprise of relaxation, labor rehearsals, and birth plans. According to Natural Childbirth the Bradley Way, the first stage labor begins with small contractions, and they build to very heavy, very hard contractions through transition. Early first labor should be a time where you rest, you eat, you drink, you focus on getting a good amount of rest so that when hard labor starts, you're rested and ready to go. Late first stage labor turns into exceptionally hard work for the mother as she moves to the side relaxation position. That's the same position we saw in the picture earlier. And she focuses on each contraction. And in the Assistant Coach's Manual by Susan and Margie Hathaway, she also tells us this is the most important time for the coach, and probably the hardest time for the coach. It's also maybe a time that you'll need the assistance of a doula or someone else to help the coach in case the coach needs to get up, take a break, eat, and go to the bathroom. Also in labor, during heavy labor, we talk about how fear can cause chest breathing and tension, and that can increase our level of pain. So if you reduce the fear by knowing what's happening and how your body is working and relaxing, then you can really release the tension, and ultimately your sensation of pain is reduced. Practice for this stage during the classes involves both mother and partner practicing different labor positions as well as simulated contractions and other situations that may arise during labor, so you know what you would do and what you want to do if a certain situation comes up. Second stage labor begins when the mother starts actively pushing the baby down the birth canal until the baby is born. This is discussed in detail by Robert Bradley in Husband Coach Childbirth. The mother will get an unmistakable urge to push. She will not be able to stop. And good positions to get in include the squatting position or variations, because that increases the outlet of the pelvis and it makes it easier for the baby to pass through. Birth plans are an important thing to mention as well, because this gives the partner, the mother, and your care providers a chance to discuss what everyone expects to happen. When writing these plans, it's good to know all your options and to also understand that the health of the mother and baby are of utmost importance, and you need to educate yourself and find out what's going to happen if you should need an IV fetal monitoring, a episiotomy, or eventually a C-section, because these are all possibilities. Now that we have a healthy mom and baby, let's talk about the care of the child. Postpartum classes focus on breastfeeding as well as care of the mom and baby. The Womanly Art of Breastfeeding by La Leche League discussed how breastfeeding is a learned art, and a lot of support is required to make breastfeeding successful for each mother. You can find it with your Bradley instructor, La Leche League, or hospital lactation consultants. We also, in my classes, discuss how to get a proper latch and what to expect as your body adjusts and your baby adjusts to the supply and demand of breastfeeding. Postpartum care for mother includes as much rest as possible. Chores and other things can wait while you get that good breastfeeding supply and demand relationship established. Other children may enjoy spending time with the baby, and according to Children at Birth by Margie and Jay Hathaway, they need to feel like they're a part of this new baby's life, but also mothers need a break, so they may enjoy spending time with dad or with grandparents. Newborns require special care as well for the first week of life. And in my classes, we mainly focus on breastfeeding and how the baby's body changes as it learns to digest breast milk, and ever-changing stool, and how to keep the baby close to you, because that's the most comfortable for him, skin-to-skin contact. And now that I've given you a snapshot of the Bradley method of natural childbirth, let me review what I've talked about. The Bradley method of natural childbirth teaches women to stay healthy and low risk from pregnancy to postpartum without any unnecessary interventions. We talk about prenatal health with good nutrition and proper exercise, and labor and birth classes comprising of relaxation labor rehearsals. Postpartum classes focus on breastfeeding, mother's recovery, and newborn care. The next time you hear a birth story, remember, there are many options available to us. The Bradley method of natural childbirth includes months of preparation for the mother and her partner, but ultimately will result in a birth that's full of confidence, relaxation, and joy.